so many of my constituents in New Hampshire. I don't think Americans want to go back to the days before the Affordable Care Act. And yet what we've seen from the administration is that they're doing everything they can to sabotage the law. And we've recently become aware of an effort by the administration to promote junk plans through healthcare.gov. I think there's a real question about what the legal authority is that the administration has to promote those junk plans outside of the Affordable Care Act, because as I understand the law, they don't have the authority to do that. But if you go to healthcare.gov, and Senator Casey has done some very impressive work on this, if you begin the process of signing up, there are links that are provided that will direct people to third-party websites that offer junk plans. And when people think they're on the healthcare.gov website, suddenly they get transferred someplace else where they're encouraged to buy a junk plan that has short-term duration, high copays, that doesn't cover pre-existing conditions in most cases, and that does not provide the health care people are looking to sign up for. This is especially important because, as we all know, the open enrollment period ends on December 15th. We want to make sure that people understand what is happening, and there is virtually very little information that's provided to consumers to let them know about what the dangers are if they're going to what they think is the appropriate website to sign up for an affordable care plan. So we have, along with 17 other of our colleagues, signed on to a letter to ask the administration to explain why they're doing what they're doing and what the legal justification is for them to be able to offer those junk plans. I am hoping that we will get an answer from this administration, that we will get an answer in time to allow us to alert the public, and so that people are not hoodwinked when they go to what is a government website, healthcare.gov, and they are sent somewhere else and encouraged to buy a plan that doesn't provide the coverage that they need. So, again, very nice to be here with my colleagues, Senator Stabenow and Casey, and Senator Stabenow.
Thank you very much. And first, I want to thank Senator Shaheen for leading this effort, leading the letter. It came to our attention that an email was sent out. We don't know the universe of who it went to at this point in time. That's one of the questions in the letter. But it was directing people to basically third-party private insurance brokers that are in many times directing people towards these junk plans. So we know that this administration, the Trump administration, and Republicans have been trying to repeal the Affordable Care Act since it was first passed, despite the fact that it provides millions, tens of millions of people with more affordable health care and good health care, because it covers maternity care and for women. It covers pre-existing conditions. It covers mental health and substance abuse treatment and other basics like an emergency room or the kind of health care that you need in terms of coverage in the hospital. So they've been trying. They weren't successful in Congress. They lost that vote because the American people rose up and said, wait a minute, my health care is personal. It's not political. What do you mean you're trying to take away health care for me and for my family? And so now they are doing everything they can to undermine health care for millions of Americans through the back door, through a court case that will be making its way up to the Supreme Court, and through the efforts that we're talking about today. And every time we think we've been shocked enough, something else happens, like now sending people to private insurance brokers through a government website that's supposed to be taking people to the health care that they can sign up for. So to add insult to injury, we have been told that the private insurance brokers may get paid up to 4 times more if they sign somebody up for a junk plan. So you get less coverage, and they get more money if they sign you up for a junk plan rather than for a comprehensive health care plan that covers pre-existing conditions for you and your family. We know that these don't cover pre-existing conditions. They don't cover maternity care. As the author of that provision in the Affordable Care Act, I've been monitoring that closely. We've not found one of those private junk plans that is covering basic maternity care for women, which is mean women are now going back to being viewed by insurance companies as just having a pre-existing condition because we may be in childbearing years. As I said before, doesn't cover mental health and addiction services and so on. The Democratic Policy Communications Committee, which I chair, has released a report today going through all of the ways that they are undermining through the back door the ability for people to get quality, affordable health care. And we welcome your taking a look at this. One of the things that they're doing, in addition to sending out emails directing people away from quality comprehensive plans to the possibility of junk plans, is the fact that they are eliminating the funding for the folks that can help people get to a good plan. It's folks called navigators who have traditionally been funded. So when you call or you go online, someone can help you work through what's the best, most affordable, comprehensive plan for you and your family. They slashed the budget for advertising to let people know that enrollment's even going on. And they have cut in half the amount of time people can sign up. So if a shorter amount of time, they don't tell you when it starts or stops, and now they're trying to undermine even fewer. So it's no surprise that hundreds of thousands fewer people have bought health insurance that's available to them, comprehensive coverage available to them. Fewer people have done that since President Trump has come into office than before. I want to also thank Senator Casey for doing an extraordinary job of laying out a whole range of things that is happening as it relates to online tricks to divert people to these private junk plans rather than getting the comprehensive care they need. Let me just close by saying, again, we believe strongly that health care is personal, not political. It's a basic human right. We want to keep moving forward to lower costs, to make comprehensive care more available. And it is a constant fight with this administration, who's doing everything they can to undermine the health care that people need. Senator Casey.
Yes.
Oops, excuse me, sir.
Thanks, Debbie. I want to thank my colleagues, Senator Shaheen, Senator Stabenow, not only for the work that brings us here today, but for many, many years of standing up for Americans who need health care, who should have the benefit of health care and the protections of the Patient Protection Affordable Care Act. We're here today because we're reporting on impediments to health care coverage or quality health care coverage. We're also here today to promote this information. And on the far corner there, maybe we should have that in bigger letters, but December 15th is the deadline. And despite these issues, despite these problems, we still want to promote every day in this open enrollment period the fact that people can check on their health insurance plans, can shop around for better plans, and the best way for them to do that is to have have accurate information. So we want to encourage people in this period, 30 some days left, to go to www.healthcare.gov, and I'll get into why that has become an important issue in a moment. I guess I want to start with a broader picture here. I would argue, as Senator Stabenow outlined, and Senator Shaheen did as well, that there are real threats to people's health care now because of what Republicans in this town have been doing. When I say Republicans, I mean the President, his administration, congressional Republicans have been doing in just 2.5 to almost 3 years now. And I think there are 3 basic threats to health care. I've even called it the triple threat. 1 is the lawsuit, 2 is sabotage, and 3 is cuts to Medicare and Medicaid. And all are current problems right now. These aren't theoretical. These aren't some debate about the future. These are happening right now. And you could use 3 verbs to describe what I'm talking about: destroy, dismantle, and defund. They're trying to destroy the Affordable Care Act by supporting a lawsuit. All the Republicans support it. All of us are against it. They're also supporting efforts to dismantle health care through sabotage. All the Republicans support that sabotage. All of us are against it. And if they are against it, just like the lawsuit, they should tell us and manifest their opposition. No one has done that on their side. Number three, they're all supporting the defunding or massive cuts, which I would argue is defunding, of Medicare and Medicaid. You add up the Medicare and Medicaid proposed cuts for the next 10 years, which all the Republicans support, it's about $2.3 trillion. So the differences between the two parties couldn't be clearer. I'll focus on number two, sabotage, dismantlement, is what we're here to talk about today. The report the cover is on my left, the enlarged version of the cover, is about this problem of junk plans, which both of my colleagues have outlined. And it's very evident from this report, and this report is about 23 footnotes. If you look on pages 6, 10, and 12 are the findings. But maybe the most important for consumers, the most important page is page 3, where we have 4 tips to consider for consumers. Number 1, to get help picking the insurance coverage that fits your needs, visit healthcare.gov. Not Obamacare, not healthcare.org, not something else. Healthcare.gov. Can't say that enough. Number 2, be aware of how the search engines designate advertisements. The report outlines how you have to be careful with that. Number 3, always look at the website address, typically displayed in green font, before clicking on a link. And tip number 4 is pay attention to the words used in the website title and description. Now, we had some help recently. Google is helping us because sometimes even when you search for healthcare.gov, that's at the top of the page, but then you go to a website below that and you find yourself on the path to a junk plan. So we're getting some help in terms of the presentation, but we've got more work to do. Let me just say in conclusion, one of the reasons why this is a problem now, as opposed to the time period up to the work of the last administration, is because this administration came into office with the policy in place where these short-term duration plans only allowed for 3 months. So you could enroll, but only for 3 months. It was meant as a short bridge from one health care plan that would give you all the protections you need to another health care plan. What did the administration do? They enlarged, by way of regulation in 2018, the 3 months to 1 year. So the purveyors of junk plans have more time to mislead people, more time to deceive people, more time to market these plans such that someone would be enrolled for a longer period of time, not knowing they don't have basic protections that they're used to. It gets worse than that, though. This regulation not only said you can enroll for a year, you can re-enroll for up to 3 years. So the policy between one administration and the next is literally 3 months is now 3 years. And that's one of the reasons why we're having a much greater problem. What the administration could do, if they truly believe in making sure that people have health care and are not deceived into enrolling in a junk plan, is to roll back that regulation to where it was when they got here. They don't seem willing to do that, but we hope that if we can call attention to this, that there'll be public pressure to bear. So with that, Senator Shaheen.
Thank you. I know that they are looking for us for votes, so I apologize. We are going to have to go vote and are happy to answer questions if you want to contact our office.
Great.
Thank you.
Thanks very much.
Thanks.
All right.